Hello, good morning, and welcome to this webinar from the Global Health Fellows Program 2, Many Roads to Global Health, the Power of Diversity and Inclusion. Please note that these materials are authored by the Global Health Fellows Program 2. We do not speak for the U.S. government. Please do not reproduce this material without authorization. Hi, my name is Sylvie Rousseau, and I am the Outreach Social Media and Communications Assistant with the Global Health Fellows Program 2. I'm going to be the moderator for today's webinar, and before we get started, I have a few housekeeping notes. So I'm going to go through a few details about the web forum that we're using, tools that we're using within the WebEx platform, and then we're going to give a little bit of overview of the Global Health Fellows Program 2. We're going to talk about diverse pathways to careers in global health and opportunities with our partner, GlobalMed. We're also going to talk about tools that you have at your disposal to break into the field of global health and to advance your careers. And then we will have a 30-minute question and answer session. If you look in your WebEx window, you'll see that there is a panel available called the Media Viewer. We are going to have closed captioning available throughout the webinar in this Media Viewer panel. On the bottom right corner of the Media Viewer panel, you'll see the option to show or hide the header. This will help you see more of the closed captioning as it's happening live. During the course of the presentation, other Windows panels may pop up, causing the Media Viewer to go away. Don't worry, though. You can always retrieve it by clicking the icon that looks like a small circle with a film strip running through it. This is what the icon looks like. And we wanted to point out that if you have any technical troubles, please write down this phone number, 866-229-3239. Again, that number is 866-229-3239. We have great support staff who will be able to help you navigate any technical difficulties. You can also use the Q&A function to submit any questions for technical issues, but also content questions for the webinar. The Q&A feature is another panel, and we ask that you send your questions to all panelists so that we can respond to you. There are people already using the Q&A. We've already got some questions coming in, and we encourage you to use the Q&A feature throughout the webinar as questions come up. We'll be answering most of the content questions at the end during our question and answer period, but we encourage you to continually send in your questions. So today's presenters are myself, the moderator. We have Dominique Hazard, Dr. Fernando Fuentes, Jennifer Russell, and Bob Leone. And before we begin, we also wanted to point out the polling feature. So throughout the webinar, we'll have different questions that we'll ask of you, the audience, and we'll ask that you respond to those immediately or directly in your browser window. You can select your choice of answer, and please click Submit so that we will receive your answer. We're going to start with two polls right now. Joanna, if you could please bring up polls 1 and 2. The first question is, how familiar are you with GHFP-II? We ask that you choose one. Are you very familiar, somewhat familiar, not very familiar, or not familiar at all, but you'd like to know more? The second poll question is, which statement best describes you? I don't know if my current skills in education are compatible with a global health career. I'm interested in global health, but not sure of next steps. I'm not sure if global health is right for me. My focus has been on domestic public health or some other specialty. I'm committed to a global health career and know what I need to do to move ahead. Or something else. Please type your answers for the other option in Q&A. So we invite you to take a few seconds to answer poll questions 1 and 2. They're on the panel, and click Submit. And these questions help us get some feedback from the audience and help us kind of move through the presentation with a better understanding of how we're going to address some of the questions you have. All right. So our first presenter today is Bob Leone, who's the lead for Outreach and Communications with the Global Health Fellows Program 2. We do have presenters coming in from, or speaking with us from all over the country. So Bob is in Oakland, California. We also have presenters in Washington, D.C. and in Houston, Texas. So Bob, please take it away.
Great. Thanks, Sylvie. Part of what we're hoping to get across today is that there isn't one set answer to this question that you see on the screen right now. There are many different aspects of the work, and there are many different kinds of practitioners from varied backgrounds doing that work. In the webinar today, we hope to show you some of the diverse aspects of global health and how you might become involved in the field. We'll start by taking a look at two of our former interns. So let's start with Jonathan DeWitt. Jonathan began his career with a non-health college major, but one remarkable experience as an undergrad caused him to turn his attention to global health issues. While attending a seminar on the then-new PEPFAR, President's Emergency Plan for AIDS Relief, Jonathan had a strong reaction that inspired him to travel to Jos, Nigeria for 4 months, despite some misgivings from his family. He says, "I found incredible value in working outside my comfort zone." In Nigeria, Jonathan worked in an HIV/AIDS clinic. He remembers, the clinic had just recently received PEPFAR funding and subsequently antiretroviral treatment to provide for HIV-positive clients. "I saw firsthand these drugs save some lives, while at least one person a day died in the clinic from advanced AIDS. I worked with the incredibly overwhelmed staff of the clinic in sometimes horrifying conditions." Returning to the U.S., Jonathan enrolled in an MPH program. Between the 2 years of study, he was a GHFP summer intern. Jonathan was considering pursuing medicine when he joined GHFP, but over the summer he was able to clarify his personal career goals. He said, "The work I was involved in at USAID was so engaging, so relevant, and so inspiring that I knew very quickly that I wanted to work on broader reaching programs and policymaking." Or let's consider Mikkel Brown. Mikkel is an engineer. She studied industrial engineering and health systems, earning her bachelor's and master's degrees at Georgia Tech. According to Mikkel, the international development community needs engineers, mathematical modelers, statisticians, and epidemiologists just as much as it needs experts in health behavior, international affairs, and social work. If you have an educational background that doesn't typically feed into global health, branch out, she says, and I guarantee you won't be disappointed. Mikkel became a GHFP intern and worked on 3 main projects during her commodity, security, and logistics internship. One was the analysis of the shipment network for reproductive health commodities, and also identifying opportunities for improved efficiency. Another was a statistical analysis of correlation between volume of commodities and prevalence rates of contraceptives in USAID priority countries. And third, she developed a supply chain evaluation tool for those priority countries. One thing she learned during her summer in Washington, D.C. is that all of USAID's work, and really all global development work, is highly contextual. Family planning brings another layer of sensitivity into the equation. After her internship, Mikkel enrolled as an epidemiology PhD candidate at the University of Southern California. Her passion for evidence-based development drives her work. Mikkel loves numbers and data. Since she's interested in applying her skill set across a broad range of projects, she knows she'll have to invest time in learning the intricacies of each contextual setting. But in her words, "I'm up for the challenge." Before we go on to our next presenter, Dr. Fred Fuentes, I'd like to take just a few minutes to offer some information about GHFP-II and its work with the U.S. Agency for International Development. So what is the Global Health Fellows Program 2? As our name indicates, we are in the second iteration of the program. The first was from 2006 through 2011. The program engages in activities that span the geographic reach of the agency. We do this primarily through internships and fellowships and by providing professional development and career management services to those who participate in the program. As you can see, fellows and interns have worked in a variety of locations. Countries listed in regular text are those where we've had or currently have fellows, while those countries in red are where we've had both fellows and interns. Lastly, countries listed in blue are those where we've had interns only. Currently, we have approximately 120 fellows active on the program, and we'll have a cohort of summer interns working with USAID in Washington, D.C. This summer. There are also on-demand internships throughout the year. The USAID-based internships each have specific requirements ranging from completion of an undergraduate degree to enrollment in a graduate program or recent completion of a graduate program. We're now in the process of evaluating the applications that we have for the summer, and we'll be making choices soon. Fellowships are at all levels, and the jumping off point for a junior level fellowship is a master's in public health or a similar degree, plus 1 or 2 years of relevant experience. The fellowships are for 2 to 4 years with placements in Washington, D.C. and overseas. U.S. citizenship or U.S. permanent resident status is required. Areas that both interns and fellows have worked in are varied. The list you see here is not exhaustive. We currently have fellows working on animal-to-human transmission of disease, voluntary medical male circumcision, behavior change communication, pandemic threats, and other areas not listed here. If it's done in global health, chances are we have an intern or fellow who has worked on it.
All right, thank you, Bob. I wanted to ask Joanna if we could bring up the results for polls 1 and 2. Okay, great. So if we see in the polling panel on the side, it looks like, according to these results, most people are somewhat familiar with GHFP-II. It looks like hopefully Bob's explanation helped somewhat with that. And we also wanted to ask what statement best describes you. And the majority of people, about 43%, said that they're interested in global health but not sure of next steps. So we definitely have some tools coming up that will help you answer those questions. I did want to remind you that the Q&A feature is available throughout the presentation. Please submit to all panelists. I also wanted to mention that a recording of the webinar will be available about 1 week after this presentation. It will be available on our website. Another reminder that the closed captioning is always available in the media viewer panel, which is represented by that icon that you see on the screen. Now I would like to introduce our next presenter, Dr. Fernando Fred Fuentes Jr. He's going to be talking to us about many roads to a career in global health. Fred is our lead for inclusion and diversity at the Global Health Fellows Program 2. Fred, take it away.
Thank you, and greetings. As one of the newest members of the Global Health Fellows Program 2 team, I'm excited about today's opportunity to present alongside my colleagues on the many roads to careers in public health, global health. Let's see here. Global Health 2 has proven to be the organization that seeks to provide the first crucial global health experience to as many candidates as possible. Approximately 50% of our applicants are from diverse backgrounds, so today this presentation has been set up to appeal to everyone. Every one of our applicants are a diverse group of interested potential candidates. Applicants with the most experience aren't always the best candidates. Rather, we seek those who might gain the greatest benefit and from whom USAID and partners will gain excellent assistance and fresh perspectives. Perhaps you're someone who is a mid-career changer with several years of experience outside of global health. Maybe you're currently enrolled in a relevant graduate program. Examples of mid-career changers include social workers with 10 years domestic work experience, or maybe a person whose main experience is within the U.S. domestic and programs. Lastly, we'd like to add that equal consideration is given to mid-career changers in the internship review process. So maximizing limited resources. And limited resources is our own interpretation based on where we live. For myself, I took a non-traditional path as indicated. So my question to you is, how do you maximize your opportunities? And what does traveling along a non-traditional path mean anyways? Ultimately, we have the power, and in our case, to self-identify or self-relate to experience of distance traveled. In my case, I was able to utilize resources that were always available, even if I didn't know them. The opportunity to make friends, contacts, and future networking. When I looked at previous websites, as with many of you today, I remember looking at who was being selected and thinking to myself, how do I compete with candidates with these experiences or from these schools? And I like to tell students who see that same thing or feel the same way, just like with the lottery, you can't win if you don't play. So if you don't apply, you're not going to be able to compete for the fellowship or internship that you're interested in. But before you can apply, you have to be prepared, of course. As a former member of the U.S. military, the first in my family to graduate high school, and an active member of my community, I was able to share my unique distance-traveled story, one that reflects academic, personal, and professional successes. So being prepared means making those contacts, making the grades, and in my case, in many cases, giving back to our community. Whether you can identify as someone from a resource-rich or resource, quote-unquote, limited area, you still have to go after your goals. If you're lucky enough to be born with access and resources, you're still expected to create opportunities, as they will likely not come to you. Likewise, with individuals from resource-limited areas, we encourage you to maintain those connections and create those opportunities. In my case, I grew up in an area or a region with significant poverty, teenage pregnancy issues, et cetera, et cetera. So preparing myself so that when those opportunities did arise was paramount to my success. Some of my successes include being a former GHFP fellow, so I know exactly what it feels like to apply for and go through the process. While it is still highly competitive, it is an excellent opportunity for diverse candidates. And I felt like my situation was sometimes limited, but I was able to see the rich and unique resources that could be used, in this case as transferable skills. Organizations such as Global Health Fellows Program II appreciate applicants who can effectively share their own distance traveled story. So take time to develop and tell your story, because we're definitely listening.
Fred,
yes.
Sorry to interrupt, but could you speak up just a little bit?
Certainly. Is that better?
You.
All right.
Yes, thank you.
So this webinar is an inclusion exercise. Just as my personal experience reflected, being prepared involves various components or paths that we all take to accomplish our goals. Inclusiveness is the idea that we work diligently to ensure that everyone is part of the decision-making process. Like my colleagues at GlobalMed often say, nothing about us without us. And this is a wonderful reflection of ensuring that we're all included and that we also always include. Every organization and hiring manager takes different approaches to ultimately achieve USAID's mission, vision, and results. We know that returns on global investment, global health issues do have consequences that not only affect people in developing nations, but also directly affect the interests of American citizens. So shouldn't a broader cross-section of Americans have input into issues that will affect them? All right. Power of diversity. While we all know the importance of diversity, yet for many people, they may not always feel welcome in an organization. Some may feel like these global health resources are not available to them. We know this isn't true, and we share with our colleagues the importance of inclusiveness and diversity in the workforce. For us, advocating for the hiring of diverse candidates, those that have distance travel stories, is paramount to the success of our company, and the data reflects that as well. We're always looking for the best candidates. We recognize that in global health, sometimes we lack representation from specific groups. Among the groups that are underrepresented in global health are African Americans, Latinos, Pacific Islanders, low socioeconomic regions, Native Americans, and veterans. The application process considers applicants' life experiences, circumstances, and personal challenges in addition to credentials. The concept distance travel takes into consideration the whole person, not just demographics. So you may be part of a diverse group that we seek, groups that represent the American people. We're all best served by attracting the best available talent, communicating its priorities to academic institutions, and developing strategies to cultivate and retain that talent. So as far as community, maybe you feel, again, like you're in a resource-limited area. Don't count out your experience that may appear to be limited when in fact you can be creative and tell a unique story or an opportunity that you've been able to work at. And this may reflect transferable skills or a distance travel story. So tell your story. We appreciate hearing your academic accolades, your scholarships, your successes, and your unique story in how you have overcome barriers and or served your community in the process. So from challenges, as you can see, this is a theme for us. We recognize the importance of viewing candidates as a whole with a story, a past, and a sincere interest in global health. So be creative, recognize that it can be challenging, highly competitive, explore all of your resources, and reflect your unique contributions. Lives have been defined by the need for resilience, flexibility, adaptability, collaboration, problem solving, navigating ambiguity, and shifting circumstances. So take time to develop how you share your skills, as many are recognized and appreciated by global health professionals. Creating opportunities for diverse groups. Here we have a sophomore experience. We've been able to be creative as an organization. We were able to provide the first international travel experience for a group of underrepresented students from a rural community. An example of creating opportunities for groups, diverse student groups, includes the sophomore experience, a collaborative effort between GHFP-II and Texas A&M University Commerce. The result of this opportunity provided 12 undergraduate students with a life-changing opportunity, one that they will likely share with many of their colleagues in the future. Their distance travel story, their unique contributions were developed and now shared, and we encourage you to do the same. So share your story. Thank you.
Sylvie, are you there? I'm not. Sylvie, do you think your phone is
sorry.
muted? Okay.
I did mute my phone. Sorry. Sorry, we are at poll 3, and we are going to open this poll now. We would like to ask, what are the barriers you see to a career in global health? Please select all that apply for this question. Are you unfamiliar with the field in general? Is a barrier financial to getting experience or education? Is it gaining developing country experience, family concerns and resistance, or something else? And if it's something else, please do type your answer in the question and answer and submit to all panelists. So you have about a minute 30 left to answer this question. Please go ahead and select all answers that apply and hit submit. And now I'd like to introduce Dominique Hazard, who is our next presenter. She is the Inclusion and Diversity Fellow, the Diversity Coordinator at the GlobalMed, who is a partner of ours. Dominique, please go ahead.
I'm Dominique, and what I do is work with one of GHFP's partners, GlobalMed, and GHFP itself to help make the movement for global health equity more inclusive through working with students. Why? Because the movement, as Fred said, needs every voice present at the table and empowered to speak and contribute in order to successfully build coalitions, innovate, and create the impact that we want to have. This is particularly true for marginalized groups, such as, this is particularly true for groups of people who are marginalized by society's power structures, such as people of color and people from working class backgrounds, people who identify as LGBT, and people with disabilities. So to tell you a little more about GlobalMed, GlobalMed is a student-run organization with 55 chapters at colleges and universities across the country. What GlobalMed does is partner each chapter with a community partner in Africa, Asia, Latin America, or the United States. And these community partners are grassroots health organizations whose leaders are really grounded in their communities. So in these one-on-one partnerships, the students spend a year communicating with the leaders of their partner organization, fundraising for them, and providing other forms of support. And the students do this after sitting down with the organizations and coming up with a plan to develop a new project or support an already existing project that the community organization has. While they do this, the students have support from our national office. This includes leadership development support. So each chapter has an advisor at the national office who meets with them regularly to help them work through the process and get through the year because it's challenging. Basically, GlobalMed is like running a small public health nonprofit at your college and university. So we provide support around that, and we also provide financial support. So through GHFP, we provide financial support to students who need it to participate in the network, to participate in internships. So part of the one-on-one partnership is also our GROW internship, where up to 7 students from each college and university are able to actually travel to their partner organization in Africa, Asia, or Latin America and spend the summer observing the impact that their project is having, planning for the next year with their partner organization, and participating in the project. So GHFP provides financial support around that and also financial support around our national events. So more about the national events. We have regional events. We have our national summit where students come to build networks and learn the latest about global public health. And then we also have trainings for folks who are holding leadership positions in their chapters. And then another part of GlobalMed is Global Health U, which is something that each chapter does every week where they sit down and discuss the sticky issues and the issues in global public health that don't have the clearest answers, where students are discussing privilege and power and oppression and how all these things work together with global public health. So basically, GlobalMed is a network of amazing and hardworking students across the country and who believe that students can play an important and meaningful role in addressing global health inequities. So the reason I'm talking about GlobalMed on this webinar is that GlobalMed is currently undergoing a process to restructure our organization and shift its culture so that it is accessible to, relevant to, and supportive of all students, especially those from marginalized groups. We're working to give as many students as possible, with the support of GHFP, the opportunity to hone the skills that will be helpful for a career in global public health and get that field experience that I talked about where you get to travel to your partner organization and build meaningful relationships with communities abroad and peers here in the U.S. through the network. And we really are doing this because we believe that no movement for justice has ever truly been successful without working to address its own internal inequities, from the women's rights movement to the environmental movement, and really every movement you can think of. It's important to for organizations to be self-aware and be doing the work of making sure that they're including as many voices as possible in the movement and giving all those voices leadership opportunities and empowering them to be a part of the organization and bring all their ideas to the table, because with that variety of ideas and perspectives and experiences, that's how we can really reduce global health inequities. So if you're interested in GlobalMed, and if you're a student who's still in undergrad, you can bring GlobalMed to your campus. So again, the benefits of GlobalMed are joining a network of like-minded peers, educating your campus about global public health, building a long-term relationship with a grassroots organization, getting hands-on experience by traveling abroad, and developing the skills you need for a career in public health. Right now, we are accepting applications from undergraduate students who care a lot about global public health and are motivated and ready to get some experience. So the deadline to apply is February 20th, 2014. If you want to hear some more information about GlobalMed, we have upcoming video info sessions tonight at 7 p.m., tomorrow at 5 p.m. EST, and Friday at 12 p.m. EST. And to join the session, it's going to be an online video info session kind of like this. You can go to bluejeans.com, BLUEJEANS.com/593929944, and we will have more information about applying. You can also visit our website at www.globalmed.org. So that's it, and we're really excited to be partnering with GHFP to build the movement for global public health and increase the diversity and inclusiveness of that movement at the same time.
Thanks, Dominique. We are now going to present our next speaker, Jennifer Russell. Jennifer is the recruitment coordinator here at the Global Health Fellows Program 2, and she has a lot of background in recruiting for a number of different global health positions at different levels. So Jennifer will give her perspective on the tools that you can use to advance your global health careers. Jennifer?
Thank you, Sylvie, and thank you to everyone attending this webinar. As Sylvie mentioned, my name is Jennifer Russell, and I'm the recruitment coordinator for the Global Health Fellows Program 2. And I'm here to talk to you about using your toolbox. And by that I mean using and building upon the tools that you already have. You may be considering a career in global health, but are asking the question, where do I start? Considering a career in global health can seem pretty daunting. You may be questioning whether or not you have the relevant skills that you need to be successful in global health, or maybe wondering how you can gain experience so that you can land a job in the field. As we've mentioned throughout this presentation, there are many roads to a career in global health. The path that you're on and the skills and experiences that you bring to the table are what makes you unique. Always remember that challenges do not have to stop you, especially if you know how to work around them. When registering for this webinar, we asked each of you to indicate the biggest challenge you face in pursuing a career in global health. 2 responses came up again and again. The first is lack of mentorship or career advice, and the second is that you aren't sure how your skills, education, and interests apply. Over the next several minutes, I'll address both of these challenges and give you targeted advice and guidance to help you think of ways that you can overcome these challenges. The first thing you want to do when considering a career in global health is to explore your passion. What areas of global health are you most interested in? This may seem rudimentary, but I often ask this question when speaking with applicants, and sometimes the list of technical areas I get in response is never ending. It's great to have interests, but when thinking about your career, you also want to have focus. If you concentrate on the technical areas that you are most interested in, you'll be better able to focus your energy on finding volunteer and other opportunities that match your interests. Besides focusing your interests, you'll also want to schedule informational interviews with professionals working in the field. This may also seem pretty rudimentary, but from what I have gathered, informational interviews are underutilized by many people. However, they're useful for people at all stages of their career, from people just starting to consider a career in global health to those contemplating a mid-career change. They're a great means for gathering information about a particular career path, practicing interviewing skills, building networks, getting resume feedback, as well as referrals. Informational interviews and networking go hand in hand. You'll want to think about reaching out to people who are already in your network, as well as people outside of your network. So let's start with someone inside of your network. Type into the Q&A box someone who is already in your network that you'd like to reach out to, and make sure that you send your response to all panelists so that I can see them. I'll give you a few seconds to send in some ideas that you have. Again, if you could just type into the Q&A box someone that's in your network that you're thinking about reaching out to. Okay, somebody said that they're advisor for an MPH program. I see my professor, an old professor from undergrad. Some people are putting out some specific names of people, so that's great. My current boss, that's great. I see a lot of professors in here, friends and colleagues, previous work supervisors. Okay, that's great. These are really great ideas. So thinking about, somebody that's already inside of your network is a great place to start. And they'll also be able to suggest people maybe that you don't know that you can also reach out to. So also thinking about reaching out to people outside of your network, besides getting referrals from people that you know, you might also want to do some research, which can take some time, but the more people you speak with and connect with, the easier it will get as you're able to get referrals. Kind of think of it like a snowball effect. So to start thinking about people outside of your network, as I mentioned before, you can get referrals from people you know, but you can also research organizations doing the work you're interested in and reach out to staff at those organizations. Or you can even use LinkedIn maybe to find experts and see if they're willing to speak with you. So now let's think about someone outside of your network that you'd like to connect with. You might not have a name in mind, but you could think about an organization that you're interested in that you would like to do research and eventually connect with the staff at that organization. Why don't you type your responses into the Q&A as well? So somebody, it could be a person or an organization that you'd like to research outside of your network. Okay, I see Bill and Melinda Gates Foundation. That's great. Wow, there's a lot of responses coming in. USAID, so that's a great one. GHFP, that's great. John Snow, APHA, World Bank. These are really great. So probably the next step would be to start doing some research on these organizations and find somebody within the organization, or maybe a few people, just so you maximize your chances of actually being able to speak to someone who's doing work in the areas you're interested in. This is great. Thanks for everyone for sending in your suggestions. So, reaching out to people that you don't know can feel a little intimidating, but don't be afraid to reach out. I had an informational interview with a woman recently who, besides speaking to me, had several informational interviews with staff at USAID and with staff at partner organizations. She didn't have a lot of personal connections to begin with, but was steadily building her network in a very thoughtful and impressive way. You might not get a response from every person you reach out to, and that's okay. Just be polite and concise in your email, and if you were referred to the person you are reaching out to by someone else, mention it. You can see in the example here, I say that I'm a public health student, and I mention a professor that suggested I reach out to this person. So if you do have a referral, it's great to mention that person. The likelihood that they'll be willing to speak with you, might increase if there's kind of a common connector amongst you. Remember that this is an informational interview, not a job interview. However, just like any other interview, you want to be prepared. Prepare your questions for the person in advance, and be sure to research the organization they work for. On this slide are a few examples of questions you might consider asking during the informational interview. What is your background? What is the work environment like? What do you find most rewarding and most frustrating? What is a potential career path? So these are just a few questions, but of course, as you're researching the organization, you might come up with more, more specific type questions as well. And of course, also be sure to ask for any referrals in the informational interview as well. So just asking if there's anyone that they would suggest that you speak with as well. Besides speaking with people in the field, you'll also want to think about ways to build your experience in the field of global health. You can do so by finding opportunities within and outside of your community. From joining GlobalMed, to volunteering locally, to finding an internship, to committing to a service opportunity in the U.S. or internationally, there are different paths for you to consider. And as you gain experience, you'll also be building on different competencies. There's a number of competencies that are valued in global health. You can see some of them listed here on this slide. Collaboration and teamwork, cultural acumen, flexibility, communication skills, and these are just a few. Whether you're working or volunteering within your community domestically or overseas, you're building on the same key competencies. And you're going to want to highlight these competencies and transferable skills in your resume and cover letter for each position listed in your resume. And I'm talking about both paid and unpaid experiences. You want to include both of those on your resume. Listed on this slide are a few areas you may think about when you're highlighting your transferable skills. Research experience, experience working with resource challenge settings, technical knowledge, writing communication skills, cultural adaptability. So let's just think about a few of these here. Think about research experience you may have. What could you include in your resume or CV? Are you skilled with SPSS? Did you help a professor with their research? Have you conducted research for a volunteer position or internship? These are all things you're going to want to include in your resume. You could also think about experience you have working in a resource challenge setting. This could include experience working in a clinic, food pantry, shelter, or maybe you even have some international experience that you want to include. Or technical knowledge gained, thinking about maybe psychosocial support skills you gained from working in a shelter, maybe food security experience from volunteering with an organization that serves a food desert, or knowledge of HIV/AIDS from working with a population with high incidence rates. These are just all examples of experience that you'd want to highlight in your resume in a meaningful way. And what do I mean by a meaningful way? Well, by a meaningful way, I mean that you want to detail your experience. It isn't enough to simply list that you have research experience or psychosocial experience. You need to paint a picture for the recruiter and highlight the details that help you stand out. There's a few examples on this slide. Rather than just saying that you volunteered at a clinic, you want to include some details. For this slide, you can see served over 10 hours each week as a volunteer HIV/AIDS tester. So the 10 hours is helpful. Did this person just volunteer once? Those are questions a recruiter might be thinking when they look at your resume, but when you include those details, it's really helpful. And also, see, they put a clinic which serves a rural, low-income population in Alaska. That signals that, they have some experience working with resource-challenged populations, so that's really helpful, too. And providing services to over 3,000 people each year. So that shows that the project that they volunteered for, the clinic they volunteered for, had a pretty good reach. So those are the kinds of details you really want to include if you can within your resume or CV. Also, you can see research information on nutrition and pregnancy and compile the findings into an informational booklet in Spanish, which was distributed at a community health fair. So rather than just saying that they have research experience, they're talking about the area that they have experience with, so nutrition and pregnancy. So that gives more details to the recruiter. And also, that they compiled the findings into an informational booklet in Spanish. So that shows that the person also, has some multilingual skills. And also, what happened with this booklet? Did it just sit on a shelf somewhere? No, it was distributed at a community health fair. So that's great details to include. And you can see the last one too, writing a grant for a new community-led food co-op in New Orleans to combat food insecurity. So just, writing a grant, so those are skills, and then also, talking about food insecurity. So it wasn't just helped create a food co-op. It's, oh no, this is to help combat food insecurity in a food desert. So those, just think about the details you can include that kind of show how your experience is unique. It's a great thing you can do. So whether you're trying to acquire a volunteer position, internship, or paid position, you want any correspondences you send or application documents you submit to be as impeccable as possible. Think of your emails and documents as the first writing samples that the potential employer or potential mentor sees. You want them to be as error-free, succinct, and engaging as possible. It's great to get noticed, but you also want to be noticed for the right reasons. When registering for this webinar, many of you identified challenges to a career in global health. I hope that this presentation has given you some ideas on how to address those challenges, from speaking to professionals in the field, to identifying opportunities within your communities, to highlighting your transferable skills. Each of these strategies can help you on your path to a career in global health. So I just wanted to mention a few other resources. The Global Health Fellows Program 2 offers free webinars throughout the year. So you might want to check out our website and YouTube channel to see some recordings of some of our past webinars. We had webinars on our internships, as well as webinars focused more on resume, cover letters, and interviews. So there's some great resources out there. And also, stay tuned for future webinars that we hold that might be relevant to your interests. We also offer informational interviews. Information on how to sign up can be found on our website, but we do hold these informational interviews over the phone, so you don't have to be in the DC area to have them. So it can help you, as you're starting to reach out to different people. It's a great resource. So you can find more information about that on our website. And here's a sampling of other resources for you to consider. You can look at them as far as gaining additional knowledge, but also maybe for finding professionals that you can speak with as you're scheduling informational interviews, and also for searching for opportunities in the field. All right, thank you again to everyone attending and participating in the webinar. Back to you, Sylvie.
Thanks, Jennifer. That's a lot of information you gave us. And as a reminder, these slides won't be available after the webinar, but we will post a recording of this webinar approximately 1 week from now on our website. So take a moment to look at these, but they will be available later as well. I also wanted to take a second to remind everyone that closed captioning is available in the media viewer, so you can follow along. Please click that icon that you see in the middle of your screen, and you'll be able to bring up the media viewer. And as a reminder, we are getting a lot of questions in the Q&A, so much appreciated. When you submit your questions, please submit to all panelists so that we can all see the questions as they come in. All right, we are going to open now our final poll. So poll 4, what is your strategy for starting or advancing your global health career? So after hearing all this information from Jennifer, Fred, and Dominique, and also from Bob, we wanted to ask what you plan to do. And you can select all that apply. Defining, refining your career goals, researching organizations doing work that interests you, gaining additional education or formalized training, or something else. And for this response, please do type your answer in the Q&A. There's approximately a minute left to answer this question, so please submit those answers in the polling window. All right. We are now going to move into the question and answer panel that will end up our webinar. So you have met most of these presenters. Bob, Jennifer, Russell, Dr. Fuentes, and Dominique all spoke with us earlier. And I also wanted to introduce Jennifer Kaindi. Jennifer is our lead for recruitment here at GHFP-II, and she also has a number of years' experience working in global health recruiting and human resources, and has a lot of background to share with you. So we're going to start with questions that we received from the audience. And one particular question that has come up is about overseas travel. So people are coming with, again, different backgrounds. Somebody's asking here, I've never traveled overseas. How can I convince my family that it's a good idea? So I'd like to ask this question of Fred, if you can give us your opinion on this. How do you convince the family that it's a good idea to travel overseas?
Important. Yes. Can you hear me? All right. I'll answer that question definitely. You know, as I was saying, family is such an important part of helping us, or sometimes limiting us in our decisions. And we definitely want to reassure our family that we're traveling to places that are safe. And the U.S. government also provides that information on locations that our fellows are at, and provides those updates if there are threat levels and what those are. But reassuring our family that we're traveling somewhere where we'll be working, supporting a community, again, doing good work, and also just letting them know that it's something that's important to you. So sharing with them why it's important to you, preparing them for those conversations, having them months or weeks in advance, and having a really formed answer to why you want to travel internationally. Share that with them, do your research, and definitely when we engage with families, they're always, a lot of families are initially apprehensive, and then when you share why and what you'll be doing and reassure them of safety, they're almost always okay with that. But we also recognize the importance of that international travel. But at the same time, if that's not an issue, let's say it's just not possible, working in your community, and again, going back to those transferable skills, and being able to do a job in your local community, serving your local community, and then providing those as transferable skills equally is important and beneficial.
Thanks, Fred. That's a really interesting perspective. I think there's one question here that has been coming up, and we wanted to address it pretty quickly. It's a question about age limits. So we have fellowships and internships, and there's a question about the age limit for those. Bob, maybe you can answer this question?
Sure. Thanks, Sylvie. Well, as far as age limit, there really isn't an age limit. For the fellowships, we have a wide range of people from roughly mid-20s on up through their 50s and 60s. So it's for those fellowship positions, it's really more about what are the skills and experiences that you bring to that particular position. So each one of the fellowships is going to have its own specific scope of work and specific qualifications, but age is not going to be one of them. And really the same thing for the internships. Although there is generally the restriction on the internships that you would be enrolled in a program in school or recently graduated. So in reality, that means many of those folks are going to be younger, but there are also people who are MidCareer Changers that have gone back to school, and so again, there isn't really an age restriction there either.
Thanks, Bob. Here's a question that I think Jennifer Kaindi might have a great answer to. The question is asking, much of my global health experience is research-based, that is lab skills, but I wish to get more experience in health at the global level. Do you have any advice on how to highlight those research skills that transfer into the global health specialty?
Thanks, Sylvie. Hi, everyone. Actually, we do get quite a number of positions that do want people with the lab skills. We actually did have an internship this summer that we posted that did require someone with lab skills. So we do get and those would be considered relevant, depending, of course, on the position. But we have had requests for, I think we called it a laboratory intern. And again, looking for someone who's worked in a lab setting, because some of the work that we do we have clinics. They're looking at clinics set up in different countries and may need someone with that type of lab experience, including pharmaceutical type of experience. So again, it's looking at what the requirements of the position are and tailoring them depending on what skills you have, tailoring them to the position, the requirements of the position. Research is definitely very relevant to majority of the positions that are open, both internships and fellowships. So it's what type of research you're doing. But that's definitely a skill that we require for most of our positions. Thank you.
Thank you, Jennifer. Here's a question for Jennifer Russell. For internships, can they be used as a bridge between a non-public health degree and public health?
Yeah, I think the internships are a great way to, bring the experience that you already have, which I would assume, you have a lot of transferable skills, but then gain that additional public health or global health experience that you need. So I think really the point of the internship is really to help people kind of get that initial experience that they need in public or global health. So that's really the purpose, is to kind of serve as a bridge, whether you're changing careers or your academic background is just different, but you're considering global health. I think that's a great way to do it.
Thanks, Jennifer. This question, I think, Fred, you'd have a great perspective on this. We have a question from a teacher who's teaching freshman and sophomore pre-nursing students in a university setting. With your background in education, I think this would be a good question for you. How would you like to see educators planting seeds about careers in global health?
Degrees and disciplines, we encourage a multi approach to addressing or enhancing those services for students or those interested in global health. For those pre-nursing students and the educators in that field, we would encourage them to plant those seeds, just as you indicated, by sharing the importance of serving your community, serving locally, serving internationally, the importance of just working collaboratively with other degrees and other disciplines, and the importance to the community and what it means to the community. Planting those seeds now and what that looks like for those undergraduate students and what that looks like in the future. That, again, you can have students interested in public health, and maybe you're the catalyst to encouraging them to pursue that degree.
Thank you, Fred. I have a question for Jennifer Kaindi here, and this is about MidCareer Changers again. So we have a question from somebody who completed their MPH 5 years ago, then worked domestically, and wanting to know how they can transition now into a global health career. A similar question from somebody who had global health experience a while ago but has been working domestically since, and wondering if that experience is still relevant. Jennifer.
Sorry. Hi. Yes, that's a great question. For the mid-career changes, now it depends on, and I don't have information on what the person's previous career was. But if it was domestically, as long as it's public health, it's very relevant. Because again, we understand and we know that not everyone has that chance to work overseas. And we have a lot of people we've hired who either just had domestic, who had just domestic experience that are currently and came through our program and are even currently with USAID. Again, it depends on what it is that you did. If it's public health, it's definitely going to be relevant, depending again on what areas. So if I had more information on the areas, I would probably may be able to respond. And I'm thinking we're seeing a lot more in mental health. I'm seeing a response, and it looks like social service, mental health, early childhood. Yes, they all are relevant. We're seeing a lot more interest in mental health now. But again, domestic work is relevant, again, depending on if it's in public health. So applying, looking at the different positions and translating that experience with how it's similar with what the requirements of the position are will at least gain some interest from the hiring manager. Thank you.
Thanks, Jennifer. I have a question that I think Dominique would have some interesting insight on. This question is saying, I'm a very passionate person about serving marginalized and neglected populations in resource-limited settings. What are your thoughts on how to engage in sustainable, long-term global health work? Dominique?
Can you all hear me?
Mm-hmm.
Okay. Yeah, that's a good question. So the goals of GlobalMed are really to do exactly that. And we got started because from a different organization that some students in Northwestern University have started. And one student happened to travel over to the partner organization, which I believe was in Uganda. And when they got there, they realized that because they hadn't been really cultivating a relationship, that they weren't having the impact that they wanted to have, and they had been sending medical supplies over to the clinic in that community that the community couldn't use. So really the strategies that we use when picking our partner organizations and developing that partnership between the student chapters and the community organization are to make sure that the partner is really leading the process. And so to do that, we maintain strong communication. So that's really the most important thing in developing a long-term relationship, is to have frequent communication. So our students communicate with their partner organization at least every 2 weeks. And so I would say that the main things are communication, and then developing a firm plan together. So the students and the partner organization work together to form a plan, with the partner organization leading the process because they know the needs of their community best. They work together to develop a process, and they write an agreement saying, this is what we're going to work together on this year. These are our goals. This is how we're going to do it. And then every year, students go back to the partner organization and check in on how the project is going. How far have the goals gone, what things about the partnership need to do better. So I think that really the key to developing the long-term partnerships, instead of the type of partnerships where the students or whoever is doing the global health work is leading the process, or just dropping in or leaving really quickly. The key things are to have communication that's strong, and to have a really clear and solid plan for how you're going to work together, how long the relationship is going to last, and what you want to get out of it.
Thanks, Dominique. I have a question for Jennifer Russell, and this is a question about building that network. So this person is asking, coming from a non-global health focused area in the Midwest, what kind of people in that area or network might be a good resource?
That's a great question. I mean, if you're thinking about connecting with people within your geographic area, which I think is what this person is asking, I think finding nonprofits or other organizations working within your community would be a great first step. You know, as we were talking about earlier, there's a lot of similar core competencies that you'd be building between, even if you're working within your own community. So, you know, researching organizations, maybe there's a local clinic or there's a shelter. I mean, you know, a lot of different types of organizations. And, you know, let's say you have an interest in HIV/AIDS, for example, you might connect with the clinic in your area and reach out to a staff there, and that would be a great first step. And then they're probably also connected to other people as well, so they'll also be able to suggest other people for you to speak with. But I do think that finding those organizations within your community is the best first step. And then, of course, it's still worthwhile to reach out to people outside of your community as well, maybe working for national organizations or just different networks that you might be able to find. But definitely, you know, working within your community is a great first step.
Thanks, Jennifer. We had a question about working internationally, and I think Jennifer Kaindi might be able to answer this one. When GHFP-II assigns fellowships and internships in different countries, how is that location chosen?
Thanks, Sylvie. That's a great question. So the way our program is set up, the different missions will request for an internship. So they'll come directly to us about their requests. We work with them with the scope of work, what they're trying to figure out what they're looking for and the best person to do the type of work that they want this person to do. So the request first has to come from the mission, and then we post the position indicating what country the position will be located. So it's really, the request has to come from the mission that has a need for that role. So that's how it works. Thank you.
Thanks, Jennifer. Here's a question that I will offer to anybody who wishes to answer on our panel. Could you share some examples of where previous GHFP-II interns or fellows are now? How has this program affected the trajectory of their careers? And actually, maybe Bob will have a good answer for this one. So previous fellows or interns, where they are now, and how the experience with GHFP-II has affected the trajectory of their careers.
Thanks, Sylvie. Well, I'd like to go back to our PowerPoint slides earlier. One of the people there was Jonathan DeWitt, and he was an intern with us a couple of years ago, and that really helped him to sort of crystallize his thinking about where he wanted to go with his career, and he was able to then move on into more, sort of successively more substantive positions within global health after that. So first he realized that was something he wanted to do. He went back and got his MPH, and then he sort of moved through that way. And then we have also, I'm putting this out there, although it's not the norm, but there have been several of the interns that we've had that have actually moved into fellowship positions at USAID after their internships, although that isn't a standard way of the way things work. But that can also happen as well. And then as far as fellows, I'm kind of drawing a blank on that. If there's anybody else that may have some other examples, that would be great.
Hi, Bob. Thanks. Sure. Actually, so for the fellowship opportunities, it's a great networking opportunity for the fellows. A lot of them obviously have different paths they take. Some being, and again, they're never guaranteed. Depends on performance, on funding. Some we've seen have transitioned to become USAID employees. Others have gone to partner organizations. Of course, they get to network and work and collaborate with a lot of the partner organizations that USAID works with, including other government contractors. So the positions create great networking opportunities, and they all go to really great jobs after the fellowship program. Thank you.
Thanks, Jennifer. Here's a quick logistical question. With regard to the internships, there is a requirement that applicants be either enrolled in or within 12 months of graduation from a master's degree, sometimes from a bachelor's program. Is it open to application after that period? And in brief, the answer is no. The internships are pretty specific, and it's important to be sure that you're applying for only internships that you meet those basic qualifications for. Another question, and actually I'd like to follow up on the previous question we had with Bob about career trajectories after being in Global Health Fellows program. I'd like to ask Dominique if she could maybe reflect on, and I know that GlobalMed is a young organization, but if you have any stories to share on participants in GlobalMed who have then gone on to continue global health careers. Dominique?
Absolutely. So GlobalMed is, like you said, it's a pretty young organization. We've been around for 7 years, but we already do have some great examples of students who have gone on to become leaders in public health. So I know recently I met a student who graduated from UCLA and was a part of GlobalMed there, who just completed an internship here at GHFP, one of the internships, and then went on to fly to El Salvador, I think, for the Peace Corps. So, you know, she's taking one path. We also have one student who went on to work for one of GlobalMed's partner organizations. So he's still kind of in GlobalMed, kind of. So he works with a partner organization in Latin America and is actually the vice president of that organization now. And so he's, when the students have the calls to check in with that partner organization, he is actually part of the call because he ended up becoming a leader of one of these community health organizations abroad. And then we also have students who went on to even fund their own organizations. So some of the earlier GlobalMed graduates enjoyed their experience working with their partner organization in Nepal so much that they went on to found a different organization in Nepal using experience that they had gained while on their GROW internship with their community organization in Nepal. So they were in Nepal and helped develop a GIS program for the community organization there that helped them track where their medical supplies were being delivered, because they were delivering medical supplies to the more rural outskirts of their community. So the students took the GIS skills that they learned during that and their experience, and they developed a new GIS software and an organization in Nepal that is helping to keep spreading that software to other health organizations in Nepal. So we have a variety of different things. Some people are doing service side of global public health. Some people are doing more technological things. Of course, a lot of students go on to med school or to get their master's in public health. But those are some examples I can think of.
Thanks, Dominique. Here's a question that Fred can answer. I have a lot of, this person has a lot of global health experience, but their degree is outside of public health. And considering the many roads, Fred, would this person still be eligible for a fellowship?
Yes, thank you. Again, another great question. Really appreciate the questions you guys are sharing with us today. To answer, definitely something that we take into beyond consideration. We really appreciate that. It definitely reflects that distance traveled, the unique story that individuals can share, and their unique perspective when talking about what your degree looks like in the global health setting. As I shared earlier, for myself, it was non-traditional in that regard. You're talking about someone with a background in providing counseling, therapy at the university, HIV/AIDS counseling, and then going into higher ed for a significant amount of time. Then, of course, transitioning to public health. But it's all relevant because my job and my degree complements my job daily. And so taking into consideration whatever that individual's degree is in, definitely look at those fellowships and internship opportunities and see which one best fits, one, their interest, their sincere interest, and their discipline and how that is complementary. So I would definitely encourage them to continue looking into our internships and fellowships and finding one that fits their degree plan and their general interest. Thank you.
Thanks, Fred. Jennifer Russell, we gave a lot of resources earlier, and I can go back to that slide, but do you have any ideas for opportunities for non-U.S. citizens and how they can get experience in global health?
Sure. We do have the citizenship and permanent residency requirement, but not all organizations do. So my suggestion would be to start doing some research of other organizations out there that don't, have that limitation. And also probably doing informational interviews would be really helpful as well, just so you can connect with people working in the field, and they might know of additional resources as well. So I think, even looking on websites like DevX listed here, that's a great website to go to look for different opportunities. And, they'll have requirements in there too as well. Even, let's see if there's other lists on here. Global Health Council can be a great kind of networking. American Public Health. All of these websites are really great resources that you can check out. And, some other organizations might also have citizenship requirements, but not all will. And if you want to connect with us as well, we do have another PDF that we could send you that is basically has other resources to consider for people who are, international students or are not U.S. citizens or permanent residents. So I guess you could email us at ghfprecruitment@ghfp.net, and I believe the resources may also be on our website, but I'd have to, maybe Sylvie can speak to that.
Yeah, Jennifer, there are definitely other career resources on our website, and they are listed in the resources for job seekers area of our website. And that email address that you mentioned, ghfprecruitment@ghfp.net, is the place you would contact for further list of resources, ideas for tips about writing your resume. Yeah, so we definitely have other resources available. Here is a question that does deal with kind of a logistical issue. Are international opportunities only available at the fellowship level? And maybe Jennifer Russell, you can answer that again.
Sure. That's a great question. So Not all of our interns have the opportunity to travel, but some do. And sometimes that's mentioned in the scope of work. So when you see that scope of work, it will mention, ability to travel, but sometimes it might not be listed. So it really does depend on the internship. We can't guarantee with any internship that you will be traveling, but many of our interns do travel. So it isn't limited to the fellowship program.
Thanks, Jennifer. Here's a question for Jennifer Kaindi. There are currently 3 internship opportunities available on the GHFP website, www.ghfp.net. Are there any fellowship opportunities opening up this year?
Thanks, Sylvie. Yes, we do hope so. Again, because the requests do have to come directly from USAID hiring manager. So as soon as we get the requests, we usually just post. So at this time, we don't have any open positions, but we do anticipate that we will get some requests hopefully soon. Thank you.
Thanks, Jennifer. Bob, you work in outreach and communications. Here's a question about informational interviews. Somebody who's asking, I don't live in the DC area. Is it possible to have an informational interview on Skype or via the phone?
Yes, thank you, Sylvie. And the answer to that question is yes. In fact, most of the informational interviews we do are by phone or Skype. And the way that you could set that up is to go to our website, www.ghfp.net. And on the home page, there's a GHFP-II news box on the left-hand side. And one of the little articles there is focused on informational interviews. So basically what you would do is you would click on that link. We ask you a couple of questions about what it is you would hope to gain from the interview. And we also ask that you send us your an electronic copy of your resume. And then at that point, someone on our staff will arrange a 30-minute phone or Skype call with you at an agreeable time. And basically we can, we would talk about pretty much whatever you want related to your resume and related to any questions you might have about working in global health or skills, kind of what are skills that you're looking for, those kinds of things. And pretty much through an employer's eyes is kind of how we're, approaching those informational interviews. These are, as a potential employer, these are the things that we find valuable, or these are the skills that we're looking for. So yes, please feel free to go ahead and set one of those up on the website.
Thanks, Bob. Here's a question for Fred. So somebody is asking about a particular personal experience. People are asking if having families or having different kinds of life experiences might negatively impact their chances at moving forward with global health careers. What can you say, Fred, about this different kind of perspective?
That families, of course, for myself and so many others, are a source of inspiration. They're the reason we work so hard. And yes, they are so unique and they can limit us sometimes. But ultimately, they're really the reason why we work so hard. And GHFP-II and our partners all work together to ensure that individuals with families are not limited in any way because they may have a young family or children. So if, in my case, I was able to travel internationally, complete my fellowship without any issues at all. In fact, I found the organization extremely supportive and understanding of family, and beyond understanding. I mean, they were just so supportive, and it really made me feel wonderful to be welcomed by this organization. And in no way did I ever feel that my family was a barrier to my success. Quite the contrary. Thank you.
Thanks, Fred. I have a question here for Jennifer Kaindi. I'm a mid-level candidate returning to the full-time workforce after a hiatus. Do you have any suggestions or concerns to be aware of?
I'm sorry, you said a mid-level candidate returning to
full-time work after a hiatus. How to present this position when applying?
Okay. I think the amount of time that, let's say, the person took from working full-time, all they have to say is took some personal time. They don't have to explain anything more than that. Just put the amount of time, took some time for personal reasons in their resume as well as their cover letter, and they don't have to explain more than that. So that should not stop them from being selected or anyone paying attention to their resume because of that. As long as, again, the person applies and relates the type of work or experience they have with the scope of work requirements, that's all that matters. And I wanted to also, just getting back on the last question about family, with positions we only consider experience, someone's experience, not any personal information. It's for us, we cannot use any personal information to look at requirements or to see who would be make the cut for any position. So it's against the law, and we do have to, we only look at people's skills, relevant skill set, and not any personal, whether they have a family or not. In fact, we don't even have that information when looking at positions and looking at resumes to consider people. Thank you.
Thanks for clarifying that, Jennifer. And I think this is going to be our last question, as it's about 12:30, and we're gonna, or Pacific time, and we're gonna start wrapping up. But Jennifer Russell, I know we talked about this key skills earlier, and you definitely talked about the transitional or translatable skills. But can you recap for us what are some key skills that we look for in fellows and interns, and in global health practitioners in general?
Sure. Every position is unique, and it will likely have its own skills that it's looking for. It could be a more research-based position, so we'd really be looking for, research experience in a given area, skills with SPSS or other statistical software, while on the other hand, somebody who's maybe working in family planning environment, we're going to want to see those conservation skills. So, every fellowship and internship, I'll add, is fairly unique. So you have to keep that in mind. But there were those core competencies that I was mentioning before, and those, I think, are all, consistent amongst all fellowships, all internships, and I would assume within other organizations. So valuing the cultural acumen, being flexible and adaptable, teamwork. So collaboration and teamwork is very important in global health. Initiative and creativity as well. Also communication skills. I think almost every fellowship and internship, there's that mention of communication skills. Prioritization and self-management. So there's these kinds of key competencies which I think are key to global health, likely public health as well too. So I think these are pretty standard. But then also keep in mind that every fellowship and internship is also unique. They're created to fill a need at USAID. So you really want to kind of understand what they're looking for within the position description when you're considering applying, and make sure that you have the skills and experience that they're looking for.
Thank you so much, Jennifer. And Joanna, if we can just bring up the results to poll 4 at this time. So again, the questions asked in poll 4 was, what is your strategy? So what are your next steps after this webinar? And it looks like people had a number of different things they were going to try to do. but the primary answer, over half the respondents answered this, was researching organizations doing work that interests me. So attending this webinar is a great first step. You're learning more about two different organizations, Global Health Fellows Program 2 and GlobalMed, and we've given you some ideas for other places to look for organizations doing the work that you're interested in. So hopefully we've given you a lot of great things to think about, and we do appreciate your time coming to meet with us today. Thanks to all the panelists, for all of your expertise and suggestions. And we do invite you to stay in touch with both GlobalMed and Global Health Fellows Program 2. On Facebook, they have a Facebook page for GlobalMed. They also make heavy use of their Instagram. You can contact Dominique at this email address, dominique@globmed.org. And then we also invite you to stay in touch with us at GHFP-II via our social media. And keep in mind that we offer informational interviews. We do university visits throughout the country. We'll actually be at the TACHE, which is the Texas Association of Chicanos in Higher Education, next week. And we're going to be next month at the AHEC, which is the Association for American Indians in Higher Education. So we're going to be doing a lot of outreach events throughout the spring and autumn, and we invite you to stay in touch with us. You can always contact info@ghfp.net and sign up for our email list to get more notifications about future webinars and other events coming up. So thank you all again for attending this webinar, for spending a few minutes with us this morning / afternoon, depending on where you are. And we hope to see you again soon. Thanks. Goodbye.